Hello, my name is Attallah Dillard. Hope you all are doing well. I am honored to present on behalf of my research team at Charles R. Drew University of Medicine and Science. Today, I'm going to be presenting our research poster titled COVID-19 Vaccine Uptake Among Public Housing Residents. Decreased uptake of COVID-19 vaccinations among African American and Latinx have been noted to be due to vaccine hesitancy, which may be the reflection of systemic inequities and medical mistrust perceived by these communities or experienced by these communities. Unfortunately, unvaccinated African American and Latinx public housing residents may have a greater risk of adverse effects of COVID-19 infection, considering the nature in which of the communities in which they live in being densely populated, as well as many of these residents experiencing multiple comorbidities that place them at increased risk of adverse effects, and highlight the importance of vaccination among these communities. The purpose of our study was to develop and implement an academic community partnered approach to decrease COVID-19 vaccine hesitancy among African American and Latinx public housing residents. This was a cross-sectional design in which we implemented community-based approaches to develop an academic community partnership in which we developed and implemented town hall forums, bi-directional town hall forums across 4 weeks for public housing residents to address vaccine hesitancy and concern. These town hall forums were facilitated by a multidisciplinary panel, including healthcare providers, physicians, registered nurses, public health experts, as well as public housing community members. This took place over 4 weeks virtually, and proud to say we're able to provide all of these town hall forums in Spanish as well as in English for monolingual Spanish speakers. Following our town hall forums, public housing residents were also invited to come to health and resource fairs within the community, in which we provided access to COVID-19 vaccines, testing, as well as additional health and resource services and information. Individuals completed a pre and post questionnaire for the town hall forums to measure their vaccine hesitancy and uptake, specifically understanding their attitudes regarding the vaccine, as well as their likelihood of vaccine uptake. Our preliminary analyses will provide descriptive findings of our understanding of vaccine hesitancy and uptake and the impact of our town hall forum and health and resource fairs on public housing residents' attitudes and likelihood of vaccination. 334 residents were exposed to our intervention, which were our our 4 bi-directional town hall forums, as well as our health and resource fairs. Of those 314 residents, 15% received COVID-19 vaccines and vaccination during our health and resource fairs. This consisted of initiating or completing their first vaccine series, as well as obtaining booster doses. In terms of COVID-19 vaccine attitudes, which may be an indicator of hesitancy, 74% of participants perceived the COVID-19 vaccine to be as important to their health after the town hall forums, compared to only 69 who reported the vaccine as being important prior to the town hall forums. Additionally, in terms of likelihood of vaccination, we found that 36% reported being very unlikely to receive their vaccines prior to the town hall forums, as compared to 10% who, only 10% who reported being very unlikely to receive their vaccine following the town hall forums. Our study indicates the potential impact of an academic community collaboration and influencing COVID-19 vaccine uptake, and as well as hesitancy among public housing residents. Our study involved the listening to community members, our community partner, which was the Housing Authority of the City of LA, in which we identified topics that were important to the community regarding COVID-19 vaccines. Additionally, what we found throughout our findings was that individuals seem to have had a change in understanding or perceptions of the vaccine being important to their health, as well as changes in likelihood of uptaking the COVID-19 vaccine. What we can start to understand from our findings that public housing residents may be hesitant towards the COVID-19 vaccinations, but our data suggests that they're at least interested in learning about it, considering the number of individuals who were exposed to our intervention of our bidirectional town hall forums, both in English and Spanish, as well as our health and resource fairs. This study has implications for future public health efforts and initiatives attempting to address hesitancy and other areas such as vaccinations for influenza, pneumococcal pneumonia vaccines, and it's an opportunity to truly collaborate with the community to make improvements in health outcomes for those who are under-resourced and often overlooked, such as public housing residents. Thank you so much for listening to our presentation.